clinical nurse specialist for organ and tissue donation here in WA. So sometimes people become sick and unwell. One or more of their organs fail to work the way they normally would do. In some circumstances, the only way for them to continue living is to receive an organ transplant.
My name's Kaz, I'm 54 and I had a lung transplant for cystic fibrosis in 1994. Cystic fibrosis causes mucus to build up in the lungs. Back then I had two choices, it was either die or have a transplant, and I wasn't ready to die yet, so I still had a lot more to do. So I chose to go down the transplant route. I was told that if I didn't have a transplant, I'd be dead within 2 years.
Hi, I'm Rowena. I'm a mother of three from Kununurra in the northeast Kimberley, and I'm here talking to you today as a organ donor mum, having lost my daughter several years ago, who was able to go on to become an organ donor to 3 recipients.
I'm Naomi, I'm a Donate Life project officer. Been working in the Aboriginal health space for about 4 years. It's so important to talk to our family about your wishes becoming an organ and tissue donor. This is because our family actually have the final decision when their time comes. And to make it easier on them in such a difficult circumstance, we want them to know what your final wish was.
My message would be, talk to your loved ones. They're ultimately the ones that make the decision. Let them know your decision, whether it is to donate or whether it's not to donate. Let your loved ones know how you feel.
The reason why I feel so important to share my daughter's story and our family story is because when my daughter passed away and became an organ donor some years ago now, we actually hadn't had the conversation with her. So we made the decision as parents without knowing in our hearts what she would have wanted. Being in the prime of her life, we just weren't talking about death, which is not a normal thing to talk about with young people, but these days my message to families is please talk about it with your young people, explain what it means.
The organs that can be donated are heart, lungs, liver, kidneys, intestines and pancreas, and the tissues that can be donated are skin, bones, eyes, heart valves, tendons and ligaments. In WA, we do eyes and bone donation. Organ transplantation saves lives. In tissue donation, it enhances people's lives. Organ and tissue donation in Australia is anonymous and an act of altruism. So your family will not know who your organs go to.
This is in place to protect you and your family and also the transplant recipient. However, there's a process that Donate Life does where you can anonymously contact the transplant recipient and they can send back updates on their progress.
You're more likely to match with someone from your same ethnic background, but it is not always guaranteed that your organs will go to someone from your cultural background or your ethnic background.
If there's a piece of advice for people out there around organ donation, it's just to have the conversation. Have the conversation with your loved ones. It doesn't matter who it is. Make your thoughts known. If people don't know, it's very hard for them to honour it. And once we're gone, it's very hard to make a decision on behalf of a loved one that's already passed. So have the conversation. Be brave. It's not easy. Talking about death is not fun. It's not always easy. But it does make life easier for us down the track if we know we've had those hard conversations and been brave enough. So we have a lot of brave conversations in our life, so make this one a conversation in your family and please talk about organ donation. We've got a chance to extend or save the life of other people here and make something good out of our tragedy, because this is the only positive thing that can come out of our tragedy. There's nothing else.
So the impact it's had on my life is all of the above. It's saved my life, it's changed my life, it's made me realise how normal, healthy people live a life. I never had that before. I just, chuck a suitcase in the car and off I go. The world's my oyster, I can do anything, and that's just something I never thought would happen. I wasn't living, I was existing. Someone will run with that gift, and literally they will run with that gift.
It's quite overwhelming. and amazing knowing that there's 3 people out there in Australia that are living their best life, free of machines, because of their newfound organs, and that's all thanks to my daughter.
Just being able to take this deep breath and the ability of being able to walk and talk and breathe at the same time was so foreign to me. People out there are existing, just purely existing as they wait for life-changing surgery, and you could be that person that changes someone's life. Every day I think of my donor, I think of my family, of my donor family, and what they must have gone through to make such a big decision. And I just let them know that thank you. Thank you.